Hey guys, in this video I would like to go over chapter 13, how to interpret a 12-lead EKG. In the past we've learned how to diagnose rhythm strips, but in this chapter we're going to focus on the 12-lead EKG. The 12-lead EKG is a diagnostics tool. Its primary purpose is to identify the presence of a myocardial infarction or ischemia. And remember, a myocardial infarction is actually a heart attack, and ischemia is the tissue death that occurs with a heart attack. So ischemia is the tissue is dying due to a loss of oxygen. The 12-lead EKG is also useful in identifying arrhythmias and other conditions such as electrolyte imbalances and drug toxicities. And also you want to make sure that when we're performing the 12-lead EKG, that we put the patient in supine position. And remember, supine position is when the patient is laying flat on their back. Moving forward, there's 6 steps that we're going to go over. There's 6 steps to interpreting a 12-lead EKG. Step 1, we want to interpret the basics. We want to identify the rhythm and calculate the heart rate, and we're going to look at the intervals. Remember, we have a PR interval, a QRS interval, and a QT interval. If you don't remember what those are, please see me and I can show you on a regular strip where to find those intervals. But first we're going to calculate the heart rate and the intervals. The question we're looking at with the intervals, are the intervals abnormally long? Are they abnormally short? Or are they just simply normal? Are they within normal limits? Remember, when we have a prolonged PR interval, this can imply that there's a block in the conduction pathway, maybe between the atrium and the ventricle, as discussed in the last chapter when we talked about AV blocks. So when we think about a prolonged PR interval, we can automatically think about a heart block that may be occurring between the atrium and the ventricle. The prolonged QRS interval can imply that there's a ventricle rhythm going on. There may be a bundle branch block. It could be electrolyte abnormalities, but remember, a prolonged QRS interval, and the QRS interval that is prolonged makes the QRS appear to be wide. Just remember, with the wide QRS, that we think there's either, number 1, something going on in the ventricle, or number 2, it could be a block that's occurring in the bundle branches that's in the ventricle part of the electrical pathway. And then a prolonged QT interval is herald for lethal arrhythmias. So if you have a prolonged QT interval, that is something to definitely be very concerned about. Moving on to number 2, we're going to determine the axis quadrant. This is step number 2. And in this chapter, we're going to learn how to do that. I'm going to go over that further in just a little bit. But step 2 is determining the axis quadrant. The axis is a method of determining the mean direction of the current flow in the heart. Determine, is this normal or not? That is the question, and I will go into in just a little bit showing you guys how to do that. But for right now, step 2 is determining the axis quadrant. That is step 2 of 12-lead EKG interpretation. Moving on down, we're going to check on, number 3 is check for bundle branch blocks or hemi blocks. A hemi block is a block of a branch of the left bundle branch. So just know, when you see that term, that is the block of a branch off of the left bundle branch. So step 3 is we're going to check for bundle branch blocks or either a hemi block. And remember, we're looking at the PR interval when we do that. Moving on down to step 4, we're going to check for ventricular hypertrophy. Hypertrophy is enlarged tissue. It's overgrown tissue. So when you think hypertrophy, we need to think about something here that's enlarged or thickened. So in step 4, we're going to check for ventricular hypertrophy, and we'll learn how to do that further in this chapter as well. We used V1 and V5 and 6 to check the QRS complexes for signs of ventricular hypertrophy. With ventricular hypertrophy, you're going to have an increased, a taller R wave. So, but for right now, just know step 4 is check for ventricular hypertrophy. Step 5 is going to be use V1 and 5 and 6 to check the QRS complexes. And again, that is going to help us look for hypertrophy. You'll have an increased R wave. And then we want to determine the presence of miscellaneous effects. And 7 is check for myocardial infarction or ischemia. And again, a myocardial infarction is a heart attack, and one of the results of that heart attack would be ischemia. Moving forward, I would like to go over this slide. This is what a 12-lead EKG looks like. The 12-lead here shows you this is lead 1, this is lead 2, this is lead 3, AVR, AVL, AVF, 1, 2, V3, V4, V5, and V6. You will see a 12-lead EKG labeled in this manner. However, you will not see these arrows. In the past, I've never seen these arrows on a 12-lead. Now, they may show up sometimes. I guess it depends on the machine. But as a rule, you will not see these arrows. What you're looking at here on this slide is showing you what direction this QRS is supposed to be pointing. In lead 1, normal is pointing upward, it's positive. In lead 2, normal would be upward, positive. In lead 3, it's upward, positive. AVR, normal is negative. See the QRS here is pointing downward, so that would be a negative deflection. That's what you're normally supposed to see in AVR. AVL is positive, AVS is positive, V1 and V2 are negative. Look at V3 and V4. V3 and V4 have an arrow going in both directions, one going up and one going down, positive, negative. Let's take a look here. We have part of this QRS that's a positive deflection and the other part that is a negative deflection. So this is called isoelectric. So you expect in V3 and V4 to have this isoelectric appearance. This is what is considered to be normal. And then in 5 and 6, we have a positive deflection of the QRS. So it is important that you guys learn what you're supposed to see. You need to know the normal. So for now, I need you to start reviewing and looking at lead 1 is supposed to be positive. Lead 2 is supposed to be positive. So when you get an EKG strip in front of you, a 12-lead EKG strip in front of you, you can take a glance at it and know, ooh, these QRSs aren't pointing in the right direction, or either they are. This is one of the parts that you'll need to know as far as troubleshooting. So please remember and learn which direction these are supposed to be going in each different lead view. Now we're going to move forward and we're going to talk about lead morphology practice. Again, what I just went over in the last slide, we're going to determine if the following QRS morphologies are normal. If not, what is abnormal? Is it pointing in the wrong direction? Is it positive? Is it negative? By analyzing the morphology of each lead, we can get an idea of whether there is a pathology on the EKG. Now, moving forward, let's take a peek at this. Let's go back. Let's take lead 1 morphology practice 1. And let's look at this one and then let's flip over. Lead 1, lead 2, and lead 3 are positive. Okay? Lead 1, lead 2, and lead 3 are positive, so that looks normal. Let's go back and compare AVR, AVL, and AVF. AVR is negative, so AVR is supposed to be negative here. That's correct. AVL is positive. AVL is positive here. AVF is positive, so AVF is positive here. V1, 2, 3, and 4. All right, V1 and 2 are negative here. V1 and V2 are negative as they're supposed to be. V3 and V4, they appear to be both isoelectric. And then 5 and 6 are pointed upward. So the diagnosis of practice strip 1 would be normal morphology, because we looked at the directions and we compared these to the slide above. You would do the same in the next slide. Lead 2. All right, so let's take a peek. Lead 1 here is normal. Lead 2 and lead 3 are negative, and they should be a positive deflection, as what we learned here in this strip. Leads 2 and 3 should be positive. So going back, these are negative. AVR appears to be okay. AVL appears to be okay. AVF, again, is negative. It should be positive. And all of the precordial leads, they appear to be okay. So this is an abnormal morphology, because leads 1 and 2 here should be positive. So this would be considered abnormal. Let's take a peek at practice strip number 3. Lead 1 is negative. It should be positive. Lead 2 and lead 3 appear to be okay. The AVR is positive, and it should always be negative. The AVL is negative, and it should always be positive. The AVF here is okay. V1 is positive, and it should be negative. V2, V3, they're V2, all right, V3 is positive, but it should be isoelectric. V4 is isoelectric. V5 and 6, these are negative, and they should always be positive. So practice strip number 3, again, is an abnormal morphology. Scrolling on down to 4, let's take a peek at 1. 1 is positive, as it should be. 2 and 3 are negative, but they should be positive. AVR and AVL, they're okay. AVF here is negative, and it should be positive. And all of these precordial leads are positive, and that is completely abnormal. So in 4, this would be abnormal morphology. So I hope you guys get some help from this. I will be doing another video, and we'll go over axis quadrant determination. I know there's probably a lot of questions about that, but hopefully this will help you get started. Thanks, and have a good day. If you have any questions, please see me.